ExamPrep.School. North Carolina Accident and Health Insurance Exam, exam code InsNC-Health02. There are 5 practice exams in this series. This video covers Practice Exam 1. The first 20 questions are free. In this video, we will be covering the following major categories for Practice Exam 1. Accident and health insurance policies. Accident and health insurance provisions. North Carolina statutes and regulations. Pertinent to accident and health. Other accident and health topics. Let's walk through the format. I'll read each question and its choices. Let's get started. Question 1. Under the own occupation definition of disability in an individual disability income policy, which of the following must the insured be unable to perform to qualify for full benefits? A. Any gainful occupation for which the insured is reasonably suited by education, training, or experience. B. The material and substantial duties of the insured's regular occupation at the time of disability. C. Any occupation that the insured is physically or mentally capable of performing. D. At least one material duty of any job for which the insured qualifies. A countdown circle appears in the top right. Once it completes, the answer is revealed. You can pause at any time if you'd like longer to think. If you'd like additional practice covering more topics, see the description for our book. The correct answer is B. The own occupation definition requires inability to perform the material and substantial duties of the insured's regular occupation at the time of disability. Other options describe knee occupation or partial criteria. Reason A is not correct. This distractor defines inability to perform any occupation, which is the opposite standard. Reason C is not correct. This describes a generic inability to work in any job, not specifically the insured's own occupation. Reason D is not correct. This implies partial or partial duty disability rather than complete inability in the insured's own occupation. Question 2. Under the any occupation definition of disability in an individual disability income policy, which condition must the insured meet to be eligible for benefits? A. Be unable to perform the material and substantial duties of any occupation for which the insured is reasonably suited by education, training, or experience. B. Be unable to engage in their prior occupation but able to work in a different job. C. Meet a specific medical impairment listed in the policy regardless of workability. D. Be prevented from performing at least 50% of duties in their usual occupation. The correct answer is A. The any occupation definition requires the insured be unable to perform the material and substantial duties of any occupation for which they are suited by education, training, or experience. Other options describe own occupation, presumptive, or partial standards. Reason B is not correct. This describes inability in the prior occupation only, which is the own occupation standard. Reason C is not correct. This refers to a medical impairment list rather than functional inability to work. Reason D is not correct. This implies partial disability in the usual occupation, not total inability in any occupation. Question 3. Which of the following losses would satisfy the presumptive disability provision, entitling the insured to full disability benefits without serving the elimination period? A. Loss of hearing in one ear and loss of clear speech. B. Loss of both hands. C. Total loss of use in one foot. D. Loss of one eye and partial hearing loss in both ears. The correct answer is B. Presumptive disability provisions typically cover the loss of 2 limbs, 2 eyes, total hearing, or total speech. Loss of both hands qualifies for full benefits immediately. Reason A is not correct. This describes unilateral hearing and speech loss, which does not meet dual total loss criteria. Reason C is not correct. Total loss of use in one foot is a single limb loss, not dual limb presumptive criteria. Reason D is not correct. This is a combination of partial vision and hearing loss, not covered under standard presumptive definitions. Question 4. Under his policy, which provision ensures he receives benefits proportionate to his lost earnings? A. Residual disability benefit. B. Presumptive disability benefit. C. Rehabilitation expense benefit. D. Waiver of premium benefit. The correct answer is A. The residual disability benefit pays a proportionate benefit based on the percentage of income lost when the insured works reduced hours, matching the partial disability claim. Reason B is not correct. Presumptive disability benefits apply to total loss of specified body parts or functions, not partial work capacity. Reason C is not correct. Rehabilitation expense benefits only cover expenses for therapy or vocational training, not income replacement. Reason D is not correct. Waiver of premium benefits allow premium payments to be waived during total disability, not partial income reimbursement. Question 5. Under which policy provision will the relapse be treated as a continuation of the original disability without a new elimination period? A. Probationary period. B. Change of occupation provision. C. Reinstatement clause. D. Recurrent disability clause. The correct answer is D. The recurrent disability clause treats a relapse within a specified time as a continuation of disability, avoiding a new elimination period and preventing reapplication of waiting periods. Reason A is not correct. Probationary periods apply to new sickness benefits at policy inception, not to relapses of an existing claim. Reason B is not correct. Change of occupation provisions adjust benefits for job changes, not for treating relapse as continuous disability. Reason C is not correct. Reinstatement clauses waive a new elimination period after policy lapse and reinstatement, not for a relapse within the same disability period. Question 6. What is the primary purpose of an elimination period in disability income policies? A. Exclude pre-existing conditions from coverage. B. Trigger cost of living adjustments after disability onset. C. Require the insured to self-finance short-term losses to reduce premium costs. D. Qualify an insured for rehabilitation services. The correct answer is C. An elimination period requires the insured to wait a set time before benefits begin, effectively requiring self-funding during that waiting period to lower premium costs. Reason A is not correct. Pre-existing condition exclusions are separate provisions that limit coverage for conditions before policy effective dates. Reason B is not correct. Cost of living adjustments are optional riders for benefit increases and are unrelated to the waiting period. Reason D is not correct. Rehabilitation services are provided under rehabilitation benefits, not as a function of the elimination period. Question 7. By choosing the benefit period to age 65 instead of 5 years, what is an expected consequence for the policy? A. The policy will include a residual disability benefit provision. B. A probationary period will be applied before coverage becomes effective. C. A cost of living adjustment feature will be automatically included. D. The policy premium will be higher than under the 5-year option. The correct answer is D. Extending the benefit period increases the insurer's long-term liability, resulting in higher premiums compared to shorter benefit durations. Reason A is not correct. Residual disability provisions are separate riders and are not automatically included with a longer benefit period. Reason B is not correct. Probationary periods are applied to certain sickness benefits at policy inception and are not determined by benefit period length. Reason C is not correct. Cost of living adjustments are optional riders and not automatically tied to benefit period selection. Question 8. Under a non-occupational policy, which scenario would not be covered? A. Sustaining a wrist fracture in a work-related construction accident. B. Spraining an ankle while hiking on a weekend. C. Suffering hearing loss from a non-workplace industrial exposure. D. Developing back pain from gardening at home. The correct answer is A. Non-occupational policies specifically exclude disabilities arising from job-related incidents. A work-related construction injury falls outside coverage. Reason B is not correct. Weekend hiking injuries are off-duty and are covered under non-occupational policies. Reason C is not correct. Industrial exposures that occur outside the workplace are not job-related and thus are covered. Reason D is not correct. Home activities like gardening are off-duty and qualify for coverage. Question 9. In major medical insurance policies, which of the following accurately defines an annual aggregate deductible structure? A. A single deductible applies once for the lifetime of the policy. B. Each insured family member must satisfy an individual deductible separately. C. A combined deductible must be met only once for all covered family members. D. Coinsurance applies until each covered claim meets its own deductible. The correct answer is C. The correct answer is a combined deductible that must be satisfied only once per policy period for an entire family unit. This structure pools all covered members' expenses toward a single annual deductible. Reason A is not correct. This description refers to a lifetime deductible, not an annual aggregate deductible. Reason B is not correct. That describes a per-person or individual family deductible rather than an aggregate deductible. Reason D is not correct. This option confuses coinsurance with multiple deductibles per claim, which is not how aggregate deductibles work. Question 10. Under an 80 divided by 20 coinsurance provision with a $500 deductible, an insured incurs $2,500 in covered medical expenses in a policy year. After satisfying the deductible, how much of the remaining expenses does the insurer cover? A. $1,600. B. $1,700. C. $1,200. D. $2,000. The correct answer is A. After the $500 deductible, $2,000 remains. At 80% coinsurance, the insurer pays 0.80 multiplied by $2,000 equals $1,600. Reason B is not correct. This amount would correspond to an 85% coinsurance rate, not 80%. Reason C is not correct. That represents 60% of the remaining expense, which does not match the coinsurance percentage. Reason D is not correct. This suggests full coverage of remaining expenses, ignoring the insured's coinsurance share. Question 11. Under a major medical policy with a $5,000 out-of-pocket maximum, which of the following expenses would not accumulate toward this limit? A. Amounts applied to the deductible. B. Coinsurance payments after the deductible. C. Co-payments for covered prescriptions. D. Monthly policy premium payments. The correct answer is D. Premium payments are not cost-sharing expenses and therefore do not count toward the out-of-pocket maximum, which only includes deductible, coinsurance, and co-payments. Reason A is not correct. Deductible payments are included in calculating the out-of-pocket maximum. Reason B is not correct. Coinsurance payments count toward the out-of-pocket limit. Reason C is not correct. Co-payments for covered services are part of the out-of-pocket maximum. Question 12. A self-insured employer's medical plan includes a specific stop-loss provision with an individual attachment point of $100,000. If an employee incurs $240,000 in covered medical expenses in a policy year, how much will the stop-loss carrier reimburse? A. $240,000. B. $140,000. C. $100,000. D. $0. The correct answer is B. The stop-loss carrier reimburses expenses above the $100,000 attachment point. Thus, it covers $240,000 minus $100,000 equals $140,000. Reason A is not correct. That choice is incorrect because stop-loss only covers amounts above the attachment point rather than the total claim. Reason C is not correct. That choice is incorrect because it represents the attachment point, not the reimbursed excess. Reason D is not correct. That choice is incorrect because the claims exceed the attachment point, so some reimbursement applies. Question 13. A major medical family policy has an embedded deductible of $1,000 per individual and $2,500 per family. 3 family members each incur $1,000 in eligible expenses, satisfying their individual deductibles. If the 4th member has $500 in covered costs, how much will the plan pay for that member's expenses? A. $0. B. $250. C. $500. D. $1,000. The correct answer is C. Because the family deductible of $2,500 has already been met by the first 3 members, the plan covers 100% of the 4th member's eligible expenses, paying the full $500. Reason A is not correct. That choice is incorrect because the deductible has been satisfied for the family, so coverage applies to further expenses. Reason B is not correct. That choice is incorrect because there is no coinsurance applied and the family deductible is already satisfied. Reason D is not correct. That choice is incorrect because benefits pay only actual expenses rather than an individual deductible amount. Question 14. Under a major medical plan, with a $25 office visit copayment and 20% coinsurance on all outpatient surgery charges, a member undergoes a $2,000 outpatient procedure. How much will the member owe in coinsurance for this procedure? A. $25. B. $40. C. $400. D. $2,025. The correct answer is C. Coinsurance applies only to outpatient surgery charges at 20% of the $2,000 cost, resulting in a coinsurance responsibility of $400. Reason A is not correct. That choice is incorrect because that copayment applies only to office visits, not surgeries. Reason B is not correct. That choice is incorrect because that reflects a 2% coinsurance rate, not the specified 20%. Reason D is not correct. That choice is incorrect because it adds a copayment to the full charge instead of calculating 20% of the charge. Question 15. An individual major medical policy covers essential health benefits without lifetime caps, but imposes a $300,000 lifetime maximum on outpatient prescription drug benefits. To comply with federal regulations, what must the insurer do? A. Categorize outpatient prescription drugs as non-essential services. B. Replace the lifetime maximum with an annual limit of $300,000. C. Obtain a waiver to allow the lifetime limit on prescription drugs. D. Eliminate the lifetime maximum on outpatient prescription drug benefits. The correct answer is D. Since prescription drugs are considered essential health benefits, any lifetime dollar limit on them must be removed to comply with federal regulations prohibiting such caps. Comparison of initial surrender charge schedules. Reason B is not correct. That choice is incorrect because substituting an annual cap does not address the prohibition on lifetime limits for essential health benefits. Reason C is not correct. That choice is incorrect because federal regulations do not allow waivers for lifetime dollar limits on essential health benefits. Question 16. In the gatekeeper model used by many health maintenance organizations, the designated gatekeeper physician is primarily responsible for which of the following functions? A. Negotiates reimbursement rates with network specialists and mediates billing disputes. B. Authorizes referrals to specialists and monitors cost and utilization of services. C. Underwrites individual member risk and sets premium rates within the network. D. Manages marketing outreach and enrollment of employer groups and individuals. The correct answer is B. The gatekeeper physician in an HMO authorizes specialist referrals and oversees utilization and cost control to coordinate care and contain expenses. Reason A is not correct. Negotiating rates and mediating disputes is a network management function, not a clinical gatekeeper role. Reason C is not correct. Underwriting and premium setting are carried out by actuaries, not by the gatekeeper physician. Reason D is not correct. Marketing and enrollment are administrative tasks handled by the insurer's sales or marketing department. Question 17. Under typical health maintenance organization provisions, if an enrollee fails to designate a primary care physician, the HMO will generally A. Permit direct access to network specialists without prior approval. B. Limit covered services to emergency care until a provider is selected. C. Assign a primary care physician to ensure continuity and coordination of benefits. D. Exclude coverage for preventive services until a PCP is designated. The correct answer is C. When an enrollee does not select a PCP, the HMO assigns one to maintain oversight of the member's routine care and referrals. Reason A is not correct. HMO plans generally require CP referrals for specialist visits, so direct access is not permitted. Reason B is not correct. Emergency services may still be covered, but services are not restricted only to emergencies. Reason D is not correct. Preventive services remain covered regardless of PCP designation. Coordination is the main issue. Question 18. A primary care physician's office within an HMO submits a referral authorization request before a subscriber's visit to a network specialist. What is the primary purpose of the referral authorization process? A. To verify that the specialist service meets medical necessity and benefit guidelines. B. To confirm the specialist's physical location within the network service area. C. To establish a contractual agreement between the specialist and the primary care physician. D. To negotiate discounted fees for outpatient procedures with the specialist. The correct answer is A. The referral authorization process ensures that planned services are medically necessary and consistent with planned benefits before care is delivered, supporting utilization management. Reason B is not correct. Verifying location is handled through network directories, not referral authorizations. Reason C is not correct. Referral approvals do not create contracts between providers. Reason D is not correct. Fee negotiations occur at contracting, not during individual referrals. Question 19. A physician group in an HMO receives capitation payments of $30 per enrolled member each month. At year-end, the group's actual care costs exceed capitation revenue by 15%. Under this capitation model, what incentive is created for the provider group? A. Increase utilization to generate additional service fees. B. Manage patient care efficiently to contain costs. C. Refer patients frequently to out-of-network specialists. D. Reduce patient enrollment to improve profitability. The correct answer is B. Capitation places full financial risk on providers for service costs. To avoid losses, providers are incentivized to manage care efficiently and control utilization. Reason A is not correct. Under capitation, providers receive fixed payments, not per service fees. Reason C is not correct. Referrals to out-of-network providers would increase costs under a capitated payment. Reason D is not correct. Providers cannot unilaterally reduce plan enrollment under capitation arrangements. Question 20. During Q1, an HMO incurs $1,200,000 in claims and has 4,000 enrolled members. In Q2, claims rise to $1,440,000 with the same membership. What is the change in per member per month cost between Q1 and Q2? A. Increase by $15. B. Increase by $20. C. Increase by $25. D. Increase by $30. The correct answer is B. In Q1, PMPM equals $1,200,000 divided by 3 months, divided by 4,000 equals $100. In Q2, PMPM equals $1,440,000 divided by 3, divided by 4,000 equals $120. The increase is $20. Reason A is not correct. This value underestimates the monthly allocation of claims costs. Reason C is not correct. This overestimates the increase given constant enrollment. Reason D is not correct. This assumes a larger proportional cost rise than occurred monthly. Enjoyed this practice test? Tap like, hit subscribe, and share it with a classmate. Got a question we should tweak? Comment below, we read them all. Find full practice exam books in the description or at ExamPrep.School.